Hi, and welcome back to the WHY-O-MYO podcast. This is Janine Stiene, your host, hoping to answer your questions about the who, what, where, when, why, and how when it comes to myofunctional therapy.
Disclaimer. All content, details, as well as education shared on this podcast are the opinions of the speaker and are for informational purposes only. Please consult with a certified medical professional regarding any questions or concerns, as this podcast should not serve as a diagnosis or replace the information received from a healthcare provider.
So, has anyone ever noticed when that you have a dimple in your chin? And I don't mean under your chin, which they call a cleft, but I mean in your chin, like right below your lower lip. There's an indentation in your chin. If you haven't noticed it on yourself, have you noticed that on others? Typically, that indentation is an overdevelopment of that muscle, which is called your mentalis muscle. Now, the mentalis muscle is not supposed to be overdeveloped. And actually, that muscle should be a lot more relaxed and be a lot less defined. But if you are a tongue thruster, the only muscles that we use for swallowing are our tongue and the muscles in our cheeks called our masseter muscles. But when you have a tongue thrust, you are unable to keep your bite closed when you swallow. And because the bite stays open for a person to be able to thrust, the muscles in your cheeks, called your masseter muscles, never develop. They don't gain tone and they don't learn how to mobilize during each swallow. So as a result, our body starts to employ compensatory strategies to help get the job done. And the job I'm referring to is swallowing. So if you're a tongue thruster, just to repeat this, and you're given food and you're asked to chew it and swallow, you would chew it up. And then right as you're about to swallow, you wouldn't close your teeth. You would keep your teeth open or your bite open, and you would swallow. And because of that, you never employ those muscles, those masseter muscles. And what happens as a result is your body starts to employ these compensatory strategies. And one of those compensatory strategies could be to tense the muscles in your neck, tuck your chin, tense your shoulders, or to purse your lips. And when you purse your lips, that ultimately tenses that mentalis muscle, which makes it become insanely overdeveloped. So when we are working with patients that have a tongue thrust and that are in need of myofunctional therapy, one of the areas or one of the facial features that we look at is we first observe to see if there are any muscles that are under or overdeveloped. And the mentalis muscle is pretty easy to see. So we're able to see that one pretty quickly. But even before we can absolutely confirm that that's why that muscle appears so overdeveloped and so distinct, is we have to ask the patient or the individual to swallow a few times. And when we're watching them swallow a few times, we try to retract their lips. And when we retract their lips and when they're about to swallow, not only can you see the tongue coming forward and thrusting forward, you can also see that they're not keeping their bite closed. And you can feel and palpate during the swallow that as a result of them not keeping their bite closed, those masseter muscles are not moving or tensing and releasing when you swallow. So now, as a result, all these compensatory strategies are put into play. But at the same time, they're starting to create issues or overdevelopments of the musculature in your face that shouldn't necessarily be overdeveloped. So when we're working with a patient who needs myofunctional therapy, the first thing, of course, is evaluating them and identifying not only the compensatory strategies that you're seeing, but trying to connect the dots and figure out what those compensatory strategies are being utilized to support, or what they're utilized in lieu of something else. And during our evaluation, we'll be able to say, okay, the overdevelopment of the mentalis muscle is secondary to the inability to utilize their masseter muscles, inability to maintain their bite. It's overdeveloped because they're pursing their lips. It's overdeveloped because their masseter muscles are not engaging. So we start to collect all this information so that we can better understand the areas of need and the areas that are affected. And a lot of times when we're working with a patient who's in need of myofunctional therapy, we have to undo as well as reteach and redo. So as we're reteaching an individual how to utilize their masseter muscles, we have to unteach them how to utilize their mentalis muscle. And we have to unteach them how to purse their lips when swallowing. And the way we do that is by reteaching them how to maintain their bite while swallowing. And by reteaching how to maintain their bite when swallowing, we're reteaching them how to engage the masseter muscles and to strengthen those muscles so that no other type of compensatory strategy would be necessary.
I hope I was able to give you some insight and answer some of your questions regarding myofunctional therapy. Please stay tuned and listen to our Myo Minute, and tune in to our Talk the Talk interviews with the many different medical, dental, and rehab professionals as they elaborate or answer your questions and address your concerns directly, especially when it's related to speech-language pathology and myofunctional therapy.